Hello and good evening, everyone. So, how are you all doing? I hope all of you are fine. And welcome to another live recall session of Neet MDS 2025 examination. So, today, as you know, we had already discussed the questions from oral surgery, oral path, and oral medicine. Now, today we are going to recall the questions that were asked in NEET MDS 2025 question paper from dental anatomy and oral histology. Okay. So if you look at it overall, around like 12 to 13 questions were asked from dental anatomy and oral histology. Now, out of these 13 questions, the maximum amount of questions were from oral histology. Okay, like 10 questions were asked from oral histology and only like 3 questions were asked from dental anatomy. Okay, and among these questions, like most of them, majority of them, like around 8 of them are like factual questions, direct, straightforward, one-liner questions only. Okay, and we had like 4 image-based questions also. And if you look at the image-based questions also, only 1 was from dental anatomy and the other 3 were from oral histology alone. Okay. Clinical oriented question, you can put that clinical oriented question under oral pathology also, but for a completion's sake, we had included under the DADH itself. So 1 clinical oriented question was also there. And the topics, let's have a look at the favorite topics of the examiners. Around this time, the favorite topic was like one was development of teeth and the other one was like enamel, including the amelogenesis part also. Okay, so development of teeth and enamel were the favorite topics this time for the examiners. 3 questions were asked from each of these topics. So that itself like contribute to like 6 questions from oral histology. Then from dental anatomy, 2 questions were related to the anatomical part. Okay, the anatomical landmark of the permanent dentition, like that. Only 2 questions were asked, and 1 question, as expected, an age estimation question was there. Image-based age estimation question was there, and 2 questions were from oral mucous membrane. Okay, usually oral mucous membrane usually carries like good weightage of questions. In the previous years also, if you look at it, oral mucous membrane, definitely 2 questions can be expected. Cementum, 1 question was asked, and salivary glands also 1 question was asked. So this was the general distribution of the questions for this NEET MDS 2025 examination. Now let's have a look at the questions. Okay, so the first question was, Buccopharyngeal membrane is formed by, okay, is it ectoderm alone or mesoderm together with endoderm, or oral ectoderm and foregut endoderm, or oral endoderm and foregut ectoderm? Okay, so once you see this question, you can easily rule out the options A and B. Okay, because I think most of the students know that buccopharyngeal membrane is formed by ectoderm and endoderm. Okay, now the option C and D is where the actual confusion comes. Okay, whether it is oral ectoderm or whether it is oral endoderm, and whether it is foregut endoderm or foregut ectoderm. Okay, so these questions we had already discussed in our fast track programs and in our live classes. We had already discussed, and we are happy to tell that around like 50 to 60% of the questions that were asked in the dental anatomy and oral histology were from the live classes. Okay, like we had discussed these topics in the live classes. I had included the questions also. Okay, so the answer here is option C, oral ectoderm and foregut endoderm. Okay, so as I had mentioned, we had already discussed about this in our live classes. So what happens around like 3rd week of embryonic development is that like 2 membranes start forming, one at the cephalic end and other one as the caudal end. Okay, so one membrane is this buccopharyngeal membrane or oropharyngeal membrane, and the other membrane is at the coil, the caudal membrane. Okay, so such two membranes were formed by around the third week of embryonic life. Now, if you look at the picture, you can see that around like third to fourth week of embryonic development, there will be only primitive oral cavity present. Okay, only primitive oral cavity will be present, which is called as the stomodium. And this stomodium will be bounded by, at the superior end, you will have the frontal prominence, and at the inferior end, you will have the cardiac bulge like this. Okay, and in between, you have the primitive oral cavity or the stomodium present. Okay, so this stomodium will be like separated from the future foregut. Okay, that is the one that is going to form the alimentary canal in the future. Okay, so our primitive oral cavity will be separated from the future foregut by a membrane which is called as the buccopharyngeal membrane. So what are the germ layers forming this buccopharyngeal membrane was the question, and it is formed by the ectoderm from this primitive oral cavity and endoderm from the foregut. Okay, primitive foregut. Okay, so that was the answer. Now let's move on to the next question. Identify the structure marked in red in the given image from the cap stage of tooth development. Okay. So what is the specialty of the cap stage of tooth development is that in the cap stage, there are some special structures that are present, which are called as the transient structures that are seen in the cap stage of tooth development. So if you look at the options that are given, all these options are the transient structures only that is seen in the cap stage of tooth development. Now, to identify which is the structure, you can see that it is somewhat around the like the base and towards the center. Okay, so we can choose that it is enamel node. Okay, enamel node, all these things also we had already discussed in our live classes. So there are 4 transient structures that are usually seen in the cap stage of tooth development. Transient structures mean these structures are present only in the cap stage. When this tooth development process goes to the next stage, that is the bell stage, these structures will not be there. They usually disappear. Okay, so such structures are called as transient structures. And there are 4 transient structures. One is enamel node, then we have the enamel cord, then we have the enamel septum, and the last one is enamel navel also. Okay, so what do you mean by this enamel node is that, imagine this is the cap stage of tooth development. So at this base, the inside the enamel organ, all the cells will be like continuously dividing. Okay, so all the cells will be continuously dividing, and it forms a knot-like structure towards the end and towards the middle of the enamel organ. Okay, so that structure, that knot-like structure formed by the continuous replication of the cells, that is called as enamel node. Okay, and when this enamel node, there are so many cells in the enamel node, when the cells, they proliferate and go upwards to the outer enamel epithelium. Okay, so this vertical extension of this enamel node, that is called as enamel cord. Okay, and when this enamel cord, when it goes and touches the outer enamel epithelium, that is called as enamel septum. Okay, because septum, because it goes and touches the outer enamel epithelium, so that when you view it under the microscope, it is like this particular septum is dividing the enamel organ into 2 parts. Okay, so that's why it is called as enamel septum. And the point where this enamel septum reaches the outer enamel epithelium, a depression will be seen there. That is called as the enamel navel. Okay, so these are the 4 transient structures, and the one that is marked in the image that is given in the question was enamel node. Okay, now next question. Merkel cells are seen in. Okay, so in which layer you will be able to see Merkel cells? Is it corneal layer, or granular layer, or spinous layer, or basal layer? Okay, so Merkel cells are like pressure sensitive cells. Okay, so they'll be very close to the nervous tissue in the connective tissue. The nervous tissue that is present in the connective tissue, these Merkel cells will be very close to them. Okay, so these Merkel cells will be usually seen in the basal layer of the epithelium. Okay, this also we had already discussed. There are 4 types of non-keratinocytes: melanocytes, Langerhans cells, Merkel cells, and the inflammatory cells. These Merkel cells, they are the specialized neural pressure sensitive receptor cells. Okay, they will look something like this. Okay, they'll be very close to the nerve endings also. Okay, so that any kind of information that they get will be easily transmitted to the underlying nervous tissue. They are non-dendritic cells, and they are most commonly seen in the masticatory mucosa, like the gingiva and hard palate is the most common. Their numbers are like really increased in the masticatory mucosa, and they have a characteristic nucleus called this rodlet shaped nucleus like this. Okay, and so many granules will be present towards the uh, end that is facing this nervous tissue. Okay, so many granules will be present also. Okay, so Merkel cells are present in the basal layer. Now, next question. The following image shows stages of amelogenesis or the enamel formation. Identify stages 5 and 6 from the given image. Okay, so what is this 5 and 6? Okay, this is also a famous image of amelogenesis that is commonly given in our textbooks and study materials. So what does this 5 and 6 represents? Yes, doctors, any answers? Yes, it mainly represents the maturative stage. Okay, so there I had already mentioned in my live classes easy way to remember the life cycle of ameloblast, which is to remember this mnemonic, that is, mom orders food for Mira, that is pizza from Domino's. Okay, so the stages of amelogenesis are morphogenic, organizing, formative, maturative, protective, and osmolytic stages. Okay, so the first stage is the morphogenic stage, and you can see that in the stages 3, 4, 5, and 6 only, the ameloblast, okay, these cells that are given here are the ameloblast or the enamel forming cells. So they are getting elongated in these 4 stages only. Now, after the 6th stage, the cell is going back to normal or becoming like very small in nature. Okay, so these 4 stages are the ones that are like secreting the enamel, or they are the most functional stages, as you can say. Okay, so first and second is the morphogenic and the organizing. Then 3 and 4 are the formative stages, as you can see on the base of this 3 and 4 stages. If you look at the base of the cells, you can see like the hard tissue formation that is happening there. And 5 and 6 is the maturative stage. Okay, you can see the ruffled border of the ameloblast here and the smooth border of the ameloblast here. Okay, so that is mainly seen in the maturative stage. Okay, so this, why this ruffled border and smoothened border means when the enamel matrix is already laid down, but in the maturative stage, more and more minerals are getting accumulated and they are increasing this thickness and hardness of the enamel. Okay, so that is what is mainly happening in the maturative stage. So when this ruffled border is present, it shows that it is like allowing more and more inorganic material to pass to that particular enamel matrix. Okay, and when the smooth border is present, smoothened border is present, then that means that it is like allowing more and more like proteins and water to enter it. Okay, so that is the main characteristics of this ruffled border and smoothened border in the amelogenesis stages. Now, next image. Okay, next question. There is an image-based question. The only image-based question from dental anatomy, and as expected, there will be like one age estimation question in every Neet MDS exam paper, and this one, identify the age of the patient from the image given below. Okay, is it 8 years or 7 years or 6 years or 5 years? Okay, so last time, like Neet MDS 2024 exam and all, if you look at it, they had just given an OPG and asked to identify the age. But this time they had made it more simpler, because if you had at least gone once through the images that are given in the Wheeler's textbook of dental anatomy, then you will have come across this image, and it is very comparatively easy to identify the age also, because as you can see, only the deciduous teeth has erupted into the oral cavity. Okay, none of the permanent teeth has erupted into the oral cavity. Only the deciduous teeth are present in the oral cavity, and the molars, the 6-year molars also have not erupted. So it's easy to choose the age from the options also. It is 5 years plus or minus 9 months. Okay, since the molars have not erupted, we are not choosing the 6 years, because molars, lower molars, they usually erupt by 6 years only. Okay, so we are ruling out that option. Okay, so we had already predicted this, like in dental anatomy, there will be an image-based question based upon the age estimation. Either an OPG can be given, or a pictorial representation like this can be given. So this was already predicted. Yes. Now next question. Von Ebner's gland is. What type of gland is von Ebner's gland? Is it serous or mucus or mixed, or is it a sublingual gland? Yes, it is a serous gland. Okay, so we had discussed about this, the lingual glands. Okay, there are three types of lingual glands. One is the glands of Weber, which is present in the near the lingual tonsillar region and the lateral border of tongue and all. And the next one is the glands of von Ebner. And the last one is the glands of Blandin and Nunn. Okay, so this glands of Weber is like a purely mucus gland. Okay, and glands of Blandin and Nunn are mixed glands that is present in the anterior surface of the tongue like this. Okay, near the tip of the tongue, these glands of Blandin and Nunn are present. Then we have the glands of von Ebner, okay, which are purely serous in nature, purely serous glands. Okay, they are present in front of the circumvallate papillae, and their secretions will go into the trough of the circumvallate papillae. Okay, so these von Ebner glands are like really important because they secrete an enzyme which is called as the lingual lipase. Okay, so these are the glands which secrete the enzyme lingual lipase. Okay, so in case of like newborn babies, when their fat intake is like really high, but the pancreatic lipase enzyme production is not that developed, then this lingual lipase is the one who is like breaking down all the lipids taken during the newborn stage. Okay, so that's why this von Ebner glands and this lingual lipase is like really important. Now, next question. Mesiolingual developmental groove is present in. So this is like a characteristic feature of one of the tooth, and where you will see this. Yes, it is mandibular first premolar. Okay, so in mandibular first premolar, like it is a small groove that is seen between the mesial marginal ridge and the lingual cusp. So it is like extending from this mesial marginal ridge and going into like above this lingual cusp. Okay, so this is the mesiolingual developmental groove we had already discussed in our dental anatomy classes. So this is a characteristic feature of this mandibular first premolar. This feature is mainly used to differentiate between the mandibular first and second premolars. Okay. Now next is, which part of the enamel shows maximum resistance to forces applied during cavity preparation? Is it cervical enamel or proximal enamel or gnarled enamel? Yes. It is option C, gnarled enamel. So what do you mean by gnarled enamel means? Usually, this is like the general orientation of the enamel rods in the deciduous and in the permanent teeth. But around the cusp tip area and all, what happens is that you can see when you take a ground section and look at it under the microscope, you will be able to see such wavy arrangement of enamel rods near the cusp tip region. Okay, so this wavy arrangement of enamel rods in this cusp tip region, that is called as the gnarled enamel. Okay, so the main importance of this gnarled enamel is that it is not a hypomineralized structure like the enamel lamellae or the enamel tuft, but it is an area of increased strength. Okay, you will be able to see like very tough forces or like increased strength in this particular region. Okay, why? Because these are the cusp tip areas. Okay, so they are the ones that is like usually prone to more occlusal forces. Okay, so there will be chances for easy fracture also. But to resist that, in a kind of like a functional adaptation of enamel, there is gnarled enamel present, which is an area of increased strength, so that it minimizes the risk of enamel fracture. And this particular area is the one that is like very difficult to cut during cavity preparation also. Okay, so the option is gnarled enamel is the correct answer. Next question. Identify the structure marked with arrow in the image given below. Okay. Is it bud joint of enamel and cementum in decalcified section, or overlapping joint of enamel and cementum under polarized light, or bud joint of enamel and cementum under polarized light, or overlapping joint of enamel and cementum in ground section? Okay. So from the image, it is like somewhat clear that this is not an image that we usually see in the textbooks and all. Okay, the images that we usually see in the textbooks will be either pink colored, like decalcified sections can be seen, or like brownish to yellow colored ground sections can be seen. Okay, but this image that is given here is like more colorful. Okay, as cementum and all like appearing in a like a lightish blue color. So you can confirm that this is not a ground section or this is not a decalcified section. Okay. Then the other option that is available is like under polarized light. Okay. So even if you have not seen a proper image of a tooth under polarized light, you can make it out like, okay, this is something that is different from the ones that we usually see in the images of the textbook or images in the study material. Okay, so this is a picture of a cemento-enamel junction under the polarized light. Now we have to look whether it is overlapping joint or the bud joint. Okay, so what do you mean by overlapping joint and bud joint? We'll see. So the bud joint means it is a sharp junction. Where the enamel ends, there the cementum starts. Okay, so that is the bud joint or the sharp junction. Then we have the gap junction like this. There is a gap between the enamel and the cementum. And then the overlapping junction like this is also present. The cementum will be overlapping above the enamel. That is also seen. Okay, so this is an example of decalcified section. This is how a ground section looks like. And this is how a section of tooth under polarized light will looks like. Okay, it will be more colorful. And this is the overlapping junction that is seen in the polarized microscope. And this is the gap junction that is seen under the polarized microscope. And this is the bud junction, the one that is given in the image in the question. Yes, that is the bud junction of the enamel and cementum under polarized microscope. Next question, Odland bodies are. Okay, what do you mean by Odland bodies? Yes, so Odland bodies are something that you see in the upper spinous layer and in the granular layer. Okay, but what are they actually? Okay, so Odland bodies are actually modified lysosomes. Okay, so these Odland bodies are also called as keratinosomes, or they are also called as lamellar granules. Okay, so these green colored arrows, they point towards a structure here. Yes, these are the Odland bodies. Okay, so these Odland bodies, they are also called as lamellar granules. These lamellar granules, because lamellations will be present in it. And these are like membrane bound organelles. And they are produced by Golgi bodies. Okay, they are produced by Golgi bodies, but they are not modified Golgi bodies. Okay, so actually they are produced by the Golgi bodies that are present in the spinous layer and in the granular layer, but they are not modified Golgi bodies. Okay, and these bodies, they contain acid phosphatase enzyme also and act as a permeability barrier. The one who actually discovered these Odland bodies is like George F. Odland. He considered it to be like mitochondria. Okay, but then later it was ruled out. And another researchers, there are two more researchers who studied about it, and they considered it like maybe it may be a keratohyalin granule or it may be a viral particle. Okay, but that is also ruled out. So now these Odland bodies, they represent a special type of epidermal lysosomes. Okay, so they are kind of like a modified lysosomes. Okay, do not get confused with modified Golgi bodies. They are produced by Golgi bodies, but they are not actually modified Golgi bodies. Okay. Next question. Most common accessory cusp that is present in the mandibular molars is? Very straightforward question. It is option A, protostylid. Okay, so if you look at all the four options, protostylid is given here, the most common accessory cusp that is present in the mandibular molars. The one that is present in the maxillary molars is cusp of Carabelli, And dense invaginatus or Lyong's premolar is usually seen in the premolars. And metaconits. Metaconits is something that you will see in the primitive kind of occlusion. Okay, in the especially in the animal occlusion and all, you will be able to see such metaconits because like cone-shaped teeth, and the ones that are on the lingual side of the molars, they are usually called as metaconits. Now, next question. Deficiency of amelogenin results in. So, what does deficiency of amelogenin results in? Is it a hypoplastic enamel matrix or enamel matrix with no rods or hypomature enamel matrix? And the fourth option was not recalled. So, what do you think it is? Deficiency of amelogenin. Amelogenin is the main protein in the enamel. Okay, like it constitutes around like 90% of the enamel proteins. Okay, so enamel, if you look at the composition of the enamel is made with 96% inorganic material and 4% organic material. So this 4% organic material contains many non-collagenous proteins. Okay, so these non-collagenous proteins can be of two types. They can be amelogenins or non-amelogenins. Okay, so these non-amelogenins include proteins like enamelin, ameloblastin, tuftelin, and amylotin, like that and all was present. But they only constitute like 10% of the total like volume. Okay. Amelogenins are the main ones, okay, which mainly contribute in the crystal growth. Crystal growth means mainly contribute in the hydroxyapatite crystal growth. Okay, so if there is any defect or deficiency of this amelogenin, what happens is that the matrix, the enamel matrix that is laid down itself is like defective. Okay, when the matrix is strong only, we can accumulate more and more minerals in it and build up a very thick or very strong enamel. Okay, but here the matrix itself is like very weak. So that will result in something called as a hypoplastic enamel matrix. Okay, it is also involved in the like the formation of the enamel rods and all, but comparatively the it will not create an enamel with no rods, but sometimes the diameter of the rod can be small or large. Such differences will only be there. Okay, so enamel with no rods is not there because of amelogenin deficiency. So, the main factor, the main the thing that it will lead to because of the deficiency of amelogenin is hypoplastic enamel matrix only. Hypomaturation, the all the other like the other proteins like the enamelin and the tuftelin, they also will contribute to it. Okay. Okay, so mainly it will result in hypoplastic enamel matrix. Now, a one-day-old child came with parents to the clinic. Intraoral examination showed a tooth in the mandibular arch. Is it a neonatal teeth or natal teeth and should be removed, or natal teeth and no need for treatment, or neonatal tooth and must be extracted? Okay, so one-day-old child. So we are assuming that the child has born with the teeth, and so the teeth, if it is present from birth, then it is present, that is present from birth in the newborns, that is called as the natal teeth. If the teeth is arising within the first 30 days of life, then only it is called as neonatal teeth. Okay, so since the question is specifically mentioned like one-day-old child, so we are taking it to be natal teeth. Okay, so for if you look at the treatment options for this natal teeth, the first thing that you can do is take radiographs. Okay, taking radiographs is like really difficult, but still if you can take radiographs and see whether it is a supernumerary teeth or whether it is a tooth in the decidus dentition. Okay, mostly like around 90% of the cases, it will be a decidus teeth that is present in the mandibular area. If the teeth is firm, then you don't have to do any treatment. But if the teeth is mobile and at risk for aspiration, then you should remove that particular natal teeth. Okay, so this is the treatment protocol for the natal teeth. Okay, if it is firm, no need of treatment. But if it is like mobile and at risk for aspiration, then remove the tooth. Okay, because of this natal teeth, sometimes ulcerations can happen in the ventral surface of the tongue also. that is called as Riga-Fede disease. Okay, so this is a classical picture of this Riga-Fede disease. If such kind of ulcerations are happening, then you should take appropriate measures. In the question, it is not mentioned whether the tooth is mobile or tooth is like fixed or anything. So we are assuming that the tooth is like very firm in its place. So it is a natal teeth which does not need any treatment. Okay. So that's all about the questions that appeared in the NEET MDS 2025 examination from the dental anatomy and oral histology. Like I had mentioned it in my previous session, these recall sessions are especially for the students who are going to attend the exam next year in 2026. For the ones who had already completed the examination, please don't get like anxious or disheartened seeing the answers, saying that, oh, like I had made a mistake like that and all. Please don't be anxious or don't get depressed and all. It's okay. Let's wait for the results and let's see how it's turning out. Okay. So all the best. Do well and goodbye and good night. Bye.